Hello, my name is ZULAIKHA. So today my groupmates and I will be presenting about Plasmodium falciparum. So Plasmodium falciparum is a human unicellular protozoan parasite and the deadliest Plasmodium species that can cause malaria in humans. It is transmitted through the bite of a female Anopheles mosquito and produce falciparum malaria. The disease most serious form, which is marked by irregular parasite and a high fever and can lead to death if it's not treated. Malaria, which can be separated into uncomplicated and severe, is a disease with a wide variety of clinical symptoms that differ not just between children and adults, but also between patients with asymptomatic parasitemia, uncomplicated malaria, severe and even fatal malaria. Next, throughout its life cycle, Plasmodium falciparum takes on a variety of forms. Firstly, sporozoid, which is from a mosquito salivary gland, multiply in the liver and eventually becomes morozoids. And then, these morozoids infect red blood cells and create tropozoids, cytones, and gametocytes, which can cause malaria symptoms. Next, the gametocytes of the mosquito undertake sexual reproduction to produce a zygote, which then develops into an okinate. Lastly, oocytes are produced from the okinate. So here's the taxonomic classification for the Plasmodium falciparum. So firstly, its domain is Eukaryota and is in the phylum of Apicoplexa, which is a large phylum of parasitic eukaryotes. Other than that, it's in the order of Hemospororida and family Plasmodidae. The genus is Plasmodium and the species called as Plasmodium falciparum.
Hello, my name is Nazatul Anisha and I will represent about treatment for malaria. So drug prescription is the best treatment to treat malaria. The types of drugs and its dosage are depending on age, the species and the type of cases. Based on this general research, there are 3 types of drugs that have been used, which are mefloquine, chloroquine, and primaquine. So Plasmodium falciparum were treated with a single dose of 250 mg mefloquine tablets and primaquine depending on age, while Plasmodium vivax were treated with chloroquine and primaquine for 4 days. I also found that there is another drugs that commonly used to treat malaria, which are halofentrin, quinine, amidoquine, and quinidine. Did you know there are a lot of research stated that there is also self-treatment for malaria, but it is considered to be rare in the study area. For your information, pregnant women has also a specific drug that depending on the pregnancy stage.
Hello, my name is SYAFIAH NAJIHAH binti MOHAMAD and I am going to present the prevention of malaria disease. So firstly, we have to apply the mosquito repellent with diethylmetatoluamide to exposed skin to keep away the insects. Next, drap mosquito netting over beds if your bedroom is not air conditioned and not screened. And after that, wear long pants and long sleeve clothing to cover your skin, especially when you are outside at night. And moreover, spray an insecticide or repellent called permethrin that acts as anti-parasite medication on your clothing, sleeping bags, mosquito nets, and other fabrics. And last but not least, put screens on windows and doors to prevent insect flying or crawling into the house. So that's all from me. Thank you.
My name is SHAZNURHELMI and I'll be explaining about the transmission of the Plasmodium species. So basically, this is the key players that plays a role in transmitting the malaria disease. The first and foremost I would like to point out is the female Anopheles mosquito. This is the most common one. Besides that is the blood transfusion and sentinel needles, and also it can spread to intraplacenta, which is the mother to the baby, to the placenta. So this is a case study that I have referred to. Basically, this is a case study about the declining number of malaria cases during a certain period of time. The case study resulted in declining incidence rates of Plasmodium falciparum and Plasmodium vivax, respectively by 72% and 76% from the year 1999 until 2004. Even though it shows a very significant amount of declining numbers, however, vivax shows a slight resistance toward the drugs. This is basically because of 2 hypotheses, which is during the merozoite phase, which is the dormant state phase, the Plasmodium stays dormant and avoid being immobilized by the anti-malaria drugs. And secondly is because of the formation of gametocytes during the early stages of blood infection, thus promoting a higher chance of it to transmit via the mosquitoes. The next slide shows the location of the study that has been carried. Also includes the general population, dividing into the gender group and the age group. Also the drug regimen that have been given to intervene with the malaria cases. And these 2 graphs are basically the amount of cases that has been declining because of the intervention. And that's about it. Thank you.
Assalamualaikum and hi, I'm presenting about a symptom of malaria. There are few symptoms that occur so a person will get infected by a malaria parasite. The first symptom, they got headache. Second is back pain. Third is nausea. And fourth is myalgia, and they got a chills when they got infected by a malaria parasite. And fifth is vomiting. Diagnostic of infections. How to diagnose a malaria parasite in human body? First, diagnostic by using a blood film. We can use a blood film by doing a T1 and a T1 to calculate and observe the gametocyte of malaria parasite in human blood. The second, the diagnostics is the person who get infected by a malaria parasite, they usually got a present fever with temperature of body 37.5 degrees Celsius and above. The third, how to detect the malaria parasite and diagnose the infection to humans is by doing a PCR. The PCR is a calculate method and accurate method to identify the species of Plasmodium itself, who the species is infect the person. That's all.
And these are our task assignment during this project.